Hey, Jen.
Hey, how are you?
Do you mind if I sign out to you?
Sure.
Great. Can we go to the conference room?
Yeah.
Okay, so I actually only have one patient today.
Oh, okay.
Actually, we can just look together, maybe. All right, so my patient's name is Miss Smith, and she's full code. She's someone that I'm a little bit concerned about, so
Okay.
something I want to pay a little bit extra attention to. So she's a 78-year-old woman who basically came in with delirium, was found to have a UTI, and has been a little bit hypotensive since there, but I'll just go through her course by problem for you. So number one is really SIRS. She has a UTI with sepsis. She's now, she's been here about a day and a half. We have her empirically on cefepime because she's from a nursing home, and that was started yesterday empirically. Her cultures show gram-negative rods, but we're waiting for the sensitivities back on those.
Okay.
She was a little bit hypotensive yesterday. That got better with fluids, and I would say that if she looks worse at all today, or you're worried about her, you could broaden her to
How
meropenem.
hypotensive was she?
So her baseline blood pressure is like 110s, and she went down to like the 90s.
Okay.
But she came up with 1 liter of fluid. And then I would say that if she worsens, you could consider broadening her coverage, maybe adding meropenem. Just one second. Sorry, it's my attending. 1 second. Hello? Hi, Dr. Smith. Actually, I'm in the middle of sign out. Is it okay if I call you back? Okay, thanks. Okay, so like I said, if you think that she looks worse or anything's changing, you could consider broadening maybe meropenem. So she also has had acute renal failure after coming here. We think it's from the hypotension and also just her acute illness. Her baseline creatinine is about 0.8, and she went up to 1.2. Today she's 1.1. We're just giving her fluids and treating her illness, renally dosing meds. She came in with delirium, like I said, that hasn't actually gotten much better. We think it's from the UTI. She's in an OBS bed, and I would just try to reorient her as much as possible and avoid medications.
And what's her baseline mental status now? I mean,
Good question. So her baseline mental status is she's alert and oriented times 3.
that's right. Okay.
She has hypertension, and I mention that mainly because she's normally on hydrochlorothiazide and amlodipine, and we're actually holding that right now because she's been hypotensive, so she's not on any blood pressure meds. And then she has paroxysmal AFib. She's not on Coumadin because of her CHAD score, and sorry, just 1 second. Can answer that one later. So she's not on Coumadin, but she's on a full dose aspirin, which we have her on here as well.
Okay.
So as far as things to do tonight, to follow up on the urine culture, it may or may not come back. It's really the sensitivities, the speciation and sensitivities that we're waiting for, so you could tailor the antibiotics based on that. And then she's in for a 7 p.m. panel. Really, we just want to look at her creatinine to make sure that it's improving. And like I said, it was 1.1 this morning. If it's not better or if it's getting worse, I would give her a little bit more fluid.
Okay.
And then if she worsens both like her blood pressure or you just overall you feel like she's not doing as well, I would broaden her to meropenem.
Okay. And does she need to be recultured if she spikes?
Yes, she'll be full culture.
Okay.
Any questions?
No? Sounds good.
Okay.